This is Dr. DeStano from DeStano Chiropractic and Rehabilitation. I want to talk about an article that I recently was reading by a famous spine researcher, Peter O'Sullivan, and he just recently published his article in the British Journal of Sports Medicine regarding 10 facts about low back pain that everybody should know. Now, low back pain specifically has chock full of myths associated with it. Things that are outdated, things that may have been told or passed on from family member to family member or friend to friend, or even well-meaning medical practitioners such as a chiropractor, physical therapist, or orthopedic surgeon, passed on to our patients. And in this day and age, with all the research that has been done on spine pain, we could at least talk about some facts about what we know about spine pain, what is true and what is not true. And it's very important that we are sharing this information with the public and with our patients, because these unnecessary myths actually lead to serious consequences. It could lead to deconditioning, because if you feel like your spine is weak or your spine's going to give out, you're going to change the way you think, you're going to change the way you move. You may start to avoid certain activities because you are afraid to hurt yourself, or you stop picking up your grandchildren, or you stop picking up your kids because you're afraid that you don't want to damage something. So inappropriate beliefs about the spine changes our psychology and our feelings, and actually leads to unnecessary treatment and possibly unnecessary procedures such as surgery or injections or other things. So it's very important that we get this information out to the public and to our patients. And after you watch this video, please share it with other people so people and patients can know what the research shows about low back pain, with just some basic facts. So the first myth to be dispelled is that low back pain is usually caused by a serious medical condition or pathology. And what we know is less than 5% of the time, low back pain is caused by a serious pathology or a serious condition. 90% of the time, low back pain is what's considered non-specific, meaning we cannot identify the exact tissue source that is causing the pain. It could be some symptoms could be caused by a disc, muscle, ligament, tendon, or all of the above. We know that pain is generated by the brain, so there's the input from the nervous system that's going to factor in to the output of pain. But most of the time, pain is not as a result of a tumor, infection, or fracture, or something such as an aneurysm. Again, like I said, those conditions are extremely rare, thankfully. In our office, in the practice of 13 years, we have seen tumors, infections, fractures, and aneurysms, but again, very, very rare. And we are highly trained, as most medical professionals, chiropractors, orthopedic surgeons, physical therapists are, to recognize what we call red flags. And those are signs or symptoms that we uncover through our exam, through our history, dealing with a patient, that alert us and let us know that something is wrong, that the patient may not be in the best office, that they should be referred elsewhere to a medical doctor or possibly an emergency room. And again, that is probably less than 5% of the time. Most of the time, low back pain can be treated conservatively with stretching, exercise, hands-on manual therapy, and it is not the cause from a serious medical condition. That's not to say that low back pain cannot be extremely painful or extremely debilitating, because it can be. But the amount of pain you're in doesn't always correlate most of the time with the severity of the condition, meaning it's not something serious even though you're hurting a lot. And again, I'm not downplaying the severity of the pain, because a lot of times we even hear from patients, they ended up in the emergency room because they got up, the pain was so bad it knocked them off their feet, they couldn't get up, they didn't know what else to do. But again, that doesn't mean that there's something seriously medically wrong, and most of the time the pain can be treated conservatively with chiropractic and rehabilitation.